Hi, I'm Aaron Robinette, Holistic Lifestyle Coach, and we're talking about the core. This is another video in this series. And the core, specifically when we think about it, we want to address chronic pain. And developing the core is a great way to do it. As I mentioned in other videos, we need to clear other factors first. But once we've cleared those factors and we know we don't have organ inflammation, a lot of the other factors there, our nutrition's good, our hydration's good, and we're ready to start working the core. Our stress level's at that level to where we've either managed it or we've lowered it enough that we can actually start doing some stuff. The next step when we talk about the core is we need to look at the imbalances within the core musculature. Now, I've assessed quite a few people, and I have very small handful of people that don't have some sort of dysfunction in their core, even if they're not exhibiting any type of pain or any type of outward postural dysfunction or postural misalignment. They can still have core dysfunction. And with that, like I've said, I've had probably about 3 or 4, and I've assessed a lot of people that have not had some sort of issue and some sort of imbalance. Partly due to the fact that our fast-paced life and our stress causes some dysfunction within our core. And then the other factor is the train dysfunction. So there's a lot of misinformation about how to work the core, what exercises to use, what's sequencing. And sequencing actually typically isn't even understood by most professionals. So we need to look at that, and we need to look at sequencing and doing certain things. I mentioned in another video, I'm trained at the Chek Institute. The founder, Paul Chek, as I mentioned in the other video, is known for saying a lot of different things, but one of the things he teaches us is to isolate and then integrate. So there's a lot of isolation exercises that have to happen to develop the core properly, and once those muscles have been strengthened enough in isolation, we can then integrate all the other muscles along with it in a stepped approach. So there's a different, not a different, but a very stepped approach to developing the muscles in the right way to build them strong enough to then become integrated with the rest of the body. So these are the things that I really look at when looking at the core, and especially when addressing chronic pain using the core.